Okay, well, Skyla Hamilton-Holderman. I'm here to talk about just a menopause book talk and about the new Menopause by Mary Claire Haver, and then also How to Menopause by Tamsen Fadal. And overall, if I stump myself, it might be brain fog or something like that. And if I start sweating up here, that's the reason why. So just to get you guys started. So overall, this is a dedication to every woman who's been plagued with health issues related to perimenopause, menopause, or postmenopause, saw answers in many different places from many different people, only to think that you are crazy because all you've been told is you are normal and nothing is wrong. So this book is for you. So overall, the history behind women and menopause just recently, 2002 roughly, the Women's Health Initiative. So there was a trial of synthetic estrogen and progestin and unfounded fear hormone therapy in women caused strokes, Alzheimer's, osteoporosis, heart attacks, and breast cancer. And so your hormones are biochemical substances synthesized and secreted in glands in the endocrine system. They travel through the bloodstream, signaling various organs and tissues to regulate the process, such as metabolism, reproduction, and mood balance. So at the time of 2002, on the front cover of Time magazine, the truth about hormones, hormone replacement therapy is riskier than advertised. What's a woman to do? And so in this trial, there were women who had hysterectomies and their uterus was removed, and women who had not. The hysterectomies of females were placed on equine horse estrogen called Premarin. The non-hysterectomy women were placed on Premarin and progestin combo called Prem-Pro. These are both synthetic. Progestin, often erroneously referred to as progesterone in the Prem-Pro combination group. The medication must not be confused with the naturally occurring progesterone in the human body. So hormones regulate the key functions, including metabolism, immune response, reproductive processes, and they play crucial roles in maintaining homeostasis, allowing the body to adapt to changes in the environment efficiently. And so the primary intention of this study was that estrogen replacement therapy was preventative for heart attacks and death. And then the secondary intention of the study was to examine the safety of the therapy as it pertained to invasive breast cancer risk and determine the impact of hormone therapy on osteoporosis. And then the trial came to an abrupt halt in 2002 because invasive breast cancer risk, the Prem-Pro group, exceeded the boundaries for safety. The Prem-Pro, or estrogen and progestin combination arm of this trial, showed significant increased risk of breast cancer, heart disease, Alzheimer's, and stroke. The Premarin, the only an estrogen arm of the trial, showed protection against breast cancer, Alzheimer's, cardiovascular, osteoporosis, and colorectal cancer. But unfortunately, the results were all banded all therapies under the same umbrella rather than the two separate arms of the trial, because the media said all hormones are bad and everyone stopped just at once. So that's the history of hormones and menopause and like women's health overall. And so hormones significantly impact physical, mental health, influencing energy levels, stress responses, and emotional well-being. Imbalances can lead to various health issues and emphasizing the importance of hormonal health. So then, this is just one particular case study where Bobby was married to a gynecologist, and the daughter was a patient. And her marriage was on the rocks due to malcontent in her marriage, due to a hormone decline of being in perimenopause at this stage of her life. And her prescriptions initially didn't help. She was put on antidepressants, and that created a weight gain. Her libido, her sex drive was non-existent, and she was not moody or depressed, but emotionally just apathetic towards her husband and her children. They felt as though the prescriptions just made her worse. Bobby went off her prescriptions and optimized her hormones and focused on the root causes of her libido, her weight gain, and her emotional apathy was addressed. And the clarity that came with her treatment plan from going on hormone replacement therapy allowed her to recognize the same misery in her own mom, who she prodded to get treatment. And 4 weeks after receiving treatment, Bobby stated, meaning her mom, I have not liked my husband for over 25 years. And now I realize it was me, not him. And she was sad about the lost years, but excited about her newfound vitality, joy, zeal for life, and sex drive. And then Bobby's husband, who is a retired gynecologist, he said, thank you for giving me my wife back. Had I known about hormone therapy while I was practicing, I would have recommended it to everyone based on getting my wife and my daughter back. Now I'm here to receive hormone therapy to keep up with my wife. So they've come back together, which is super helpful. So causes of perimenopause hormone imbalances is the hormones shift in your body as estrogen and progesterone decreases within the body during perimenopause, menopause, and postmenopause. Other imbalances can arise from several other factors such as stress, poor diet, lack of exercise, medical conditions such as diabetes, thyroid disorders can exacerbate signs and symptoms. Environmental toxins and hormonal medications may disrupt the delicate hormonal balance within your own body. So there's 34 symptoms of perimenopause. You guys want me to go through all of them?
Can you act them out?
Yeah. Sweat. Can you get sweating?
Yeah.
Okay. So I'll go over a couple, I'll just do them in groups. And it's shocking when you hear some of these, you're like, oh, wow, that pertains to me. So in your body, acidosis, adrenal exhaustion, allergies, bad breath, bleeding gums, blind spots, blood pressure, both high and low, blood sugar dysregulation, body odor, very common. So if you start to feel like you smell like onions, that is a very common experience for most women that are dealing with shifts in their estrogen and their progesterone in their bodies as they go through this process. Breast pain, tenderness, breast size change, bruising, burning scalp. These are shocking ones. Burning tongue and mouth. This actually happens to people. Carpal tunnel syndrome. Changes in your body shape, changes in your sense of smell, chills, clumsiness, cold flashes, crawling sensations, dizziness, double vision, dry eye, electric shock. Some people have reported electric shock on their tongue continuously and barely relenting. So luckily within these two books, there are options to get better as you go along, and they point you in the right direction for all of these signs and symptoms. Fatigue, low energy, frequent urination, frozen shoulder, hard, bloated stomach, headaches, migraines, hearing problems, heart palpitations. So I have a friend who is younger who complained just recently about heart palpitations. And that made me think, oh, well, maybe she's about to go into perimenopause or she's showing signs and symptoms of it, but then also to rule out that there isn't a bigger issue at hand with your heart. High cholesterol, high or low cortisol, inflammation, insomnia, hot flashes, which most people associate with perimenopause and menopause, and inflammation, insomnia, vibrations. Itchy ears is actually a very common sign and symptom, and it's due to decreased estrogen, and it can create issues within your ears where it starts to dry and becomes itchy. Joint pain, lightheadedness, muscle atrophy. So at this point of the game, I want everyone to focus on building more muscle and becoming stronger as we go into the latter years of our life, so that you can still metabolize all the food that you're eating and still have strong muscles, so that you can keep your body healthy as long as possible and keep that bone structure really healthy. So sarcopenia is the loss of muscle. Muscle cramps, night sweats, non-alcoholic fatty liver disease, ocular migraine, osteoporosis, pain and rectal pain. And then it goes into digestive health, such as abdominal pain, acid reflux, constipation and gas, food cravings, heartburn. And then we get into the mind, such as ADHD, feeling a sense of doom, anxiety, brain fog, depression, lack of focus, nightmares, panic attacks, sleep problems, and then sexual health, bacterial vaginosis, bladder spasms, heavier periods, increased libido, irregular periods, lighter periods, loss of low libido, PMS, shorter periods, urinary incontinence, urinary tract infections, and vaginal dryness. And then with your skin and beauty, your acne. Sometimes people have a resurgence of their acne, brittle nails, dry hair, dry itchy skin, melasma, unwanted hair growth, and then wrinkles. So we got a mixed bag over here. And out of 34 signs and symptoms, most people can relate and maybe tick some off that they've happened to you. So the purpose of so then in regards to both of these books, with Tamsen's, I found on How to Menopause, I found that it was very helpful in reading her book. She kind of, through going through all the pages, she gives you the power to find a health provider that works for you. And she gives some tips on myths related, is specifically to hormone therapy, and she had six of the main ones, and that when you encounter this with your own provider, maybe in the back of your head, if you get a red flag, you do have the power to seek out another provider that may work better with you, have a better rapport, and take your concerns really seriously. So I just want to empower you to make that good decision. And also when you're dealing with friends or family members who you feel as though they may be in the same situation, like, you can empower them to make a better decision, somebody that will fit with them. And it's not the provider's fault. In like nursing school for me, menopause, perimenopause, and postmenopause was a blip in the whole, all of my schooling. We were focused on all the other aspects of female reproduction, but then when I got to there, it was done. And same with many providers out there, they barely get, I think Mary Claire talks about 6 hours and then a small amount on rotation. And she was an OBGYN. So it's not their fault. But there are resources for you to make a good decision for yourself. So myths related to hormone therapy, that your doctor may say it's dangerous. So it's dangerous unless you suffer from any of the contraindications, and that's in chapter 4. And this statement from your provider may be a holdover from the WHI study. But you can go to the Menopause Society and you can research who are good providers in your own area, and you can link it up, and there's lots of references and other people have given testimonials about different providers in your area, so you can get feedback and information. For women aged younger than 60 years who are within 10 years of menopause onset and who have no contraindications, the benefit risk ratio is favorable for treatment of bothersome vagal motor signs and symptoms and prevention of bone loss. So, and then another myth is that personal history of unprovoked blood clots. So there is no increased risk of blood clots when the estrogen replacement is delivered through the skin. Only oral estrogen metabolized by the liver is associated with a small risk of blood clots. If a known blood clot has happened to you in the past, such as a physical trauma or a surgery, then that's not considered to be a risk factor for your hormone therapy. And then you have high blood pressure. Your doctor should treat your high blood pressure, not use it as an excuse to refuse your hormone therapy. And within age guidelines, hormone therapy is a cardioprotective agent and will help keep your blood vessels soft and flexible. If beyond the recommended guidelines, more than 10 years past menopause or over the age of 60, and you have cardiovascular risk, that might be a valid reason for saying no. But have them run a benefit risk analysis for cardiac issues including a coronary calcium score or Cleveland Clinic risk calculator. So there's some options to see what's going on with you specifically. And then you have migraines. Lots of people in the past have been told that they can't go on hormone therapy because of their migraines. Women with migraines can take hormone therapy. Women with aura migraines should not take birth control pills, but it is a different form of estrogen at a higher dose. Even those who have migraines with an aura can take hormone therapy. Migraines without an aura are sensitive to hormonal fluctuations, especially falling estrogen. In a transdermal estradiol spray, Evamist, some people have received, and they're nearly symptom-free after utilizing that. Another myth, your blood hormone levels are normal. Hormone levels in the blood fluctuate, so a test isn't always an accurate snapshot of where your hormones actually are. It's the way that you feel that matters. You can have normal looking blood levels, but still be suffering. So your signs and symptoms are most important to your provider. And then you're too young. It's very unlikely, but it's still possible to go through menopause in your teens. There's random cases out there where that has happened. If under 45 and you suspect that you might be perimenopausal, start tracking the frequency and severity of your symptoms, and then find yourself a menopause savvy provider. Going through early menopause means that you'll be deprived of the protective effects of estrogen for longer than the average age of person who goes through menopause. You're still having periods. You can still have your period and be hugely symptomatic. If your doctor says this, it indicates that they don't understand perimenopause. And then your periods have stopped. So what counts is how long it's been since they stopped. If it's within 10 years and you're under 60, HRT, hormone therapy is still recommended if you have symptoms. And then you're too old. Here, the evidence is clear. There's no increased risk of blood clots when the estrogen replacement is delivered through the skin. Only oral estrogen therapy that is metabolized by the liver is associated with a small risk of blood clots. And then if it's caused due to trauma or another risk factor due to surgery, then it's not considered to be a risk factor for you. And lastly, your periods have stopped. This is another case for overcautiousness, trumping women's right to make their own decisions. While it is true that some studies have found that increased breast cancer after 5 years of combined hormone therapy use, that risk, about 5 additional cases per 1,000 women, is equivalent to drinking 2 glasses of wine per day. You should be able to decide the risk benefit of hormone therapy with your doctor, just as you calculate the risk of a behavior such as imbibing in alcohol consumption. So Dr. Mary Claire Haver, she says that the Menopause Society guidelines are clear. There's no age at which women must stop hormone therapy. If you start within the cardiovascular and neuroprotective window, those benefits don't stop at a certain age. That being, Dr. Haver suggests a yearly checkup. When I see clients every year, we do a brand new risk-benefit analysis. And have they developed any contraindications? Are you still happy? Do they still want to continue this medication? You should continue hormone therapy for the rest of your life if if the benefits outweigh the risks and you have a shared decision making with your doctor and you want to continue it. So between these 2 books, How to Menopause and then The New Menopause, I will say Tamsen's book is much more not like a girlfriend's guide to menopause, but has more information regarding how to advocate for yourself. She gives a lot of evidence-based practices and outcomes and shares that with you. And then Dr. Mary Claire Haver, hers is more scientifically driven, and then there's science behind everything that she's talking about. So depending on how much of a deep dive you want to do, I find that both, personally for me, granted I'm in the industry, I found both books resonated with me really well. However, if one is a little bit over the top, definitely I would use it as something to refer to if you have issues that come up. And so I wanted to talk about those 2 books because you're going through a process similar to puberty. And you might have read, Are You There, God? It's Me, Margaret. Maybe I'm dating myself, but that might have been during puberty or 5th grade, and you read that with your friends during that challenging time. And then later on, if you did have kiddos, what to expect when you're expecting. That was a helpful book just to talk about signs and symptoms that you may see as you're going through your pregnancy, and it might have been something that you leaned on. So as Tamsen had some really good questions, they actually have a book club guide. So if you and your girlfriends, you and your mom, you and your husband decided to read this book together, she has some great questions that might spur some conversation and make you think a little bit further about menopause. One particular question was, who taught you about menopause? Who talked about it with you? What did they tell you? If you're in menopause, how did your doctor react to it or help you with solutions? What are your burning questions about perimenopause or menopause? And do you feel comfortable talking to your partner about menopause? What has your doctor told you about your current hormonal status? And so that's before you read the book. And then as you get into it, she talks about long-term health consequences of menopause and talking to your doctor about those openly to get a clear picture of what is coming down the pipe towards you and how to deal with it as it comes along. And she also suggests having a list of questions that you can ask your doctor as you go along. And so in the packet that I handed out, in the back, there's a rating system for the symptoms that you encounter. And then also there's a couple note pages that Marie Claire Haver talks about having to jot down some notes before you go into your next doctor's visit. So these are just some examples of how some people have received hormone treatment and they've been able to get rid of chronic menstrual migraines, and also breast cancer survivors. They're often told that there's no hormone therapy available for them. However, both Tamsen and Dr. Marie Claire Haver talk about talking to your doctor directly about the risk benefit analysis specifically for you. And that's, as we move forward, it's individualized patient care for you and your signs and symptoms of where you are at in this process. And unfortunately, it is a moving target. So you might have been able to say, oh, like out of those 34 signs and symptoms, I only have 4, but who knows, as you move further towards the goal line, like what will happen as you move towards menopause and post-menopause. Some other signs and symptoms might pop up. So then these are just a bunch of individual stories of people going through and receiving hormone therapy. And so customized healthcare at this stage of your life, find a provider who will walk through this journey with you. If you feel dismissed, find a second opinion and get a provider who's ready to support you through this journey. Nutrition, exercise, supplementation, hormone therapy, and medications. This is a vulnerable time in your life. You may not understand what is happening. Your spouse, your children, or your boss may be completely confused about what is going on with you. And even yourself, you're like, this is not me. This is not who I am. So I give you permission to take time for yourself and your health. And all those people will, and yourself will thank you for taking that time to try to figure out what is going on and go and get help and go get nutrition, exercise, supplementation, hormone therapy, or medications that may help you through this journey. And then prioritize sleep. It's very important. And right now, it may be very difficult for you to get optimal sleep. You may be having night sweats in the middle of the night. And so there are many suggestions in both of the books in how to help yourself get the sleep that you need. And it can start with just pure sleep hygiene, getting your mindset ready, maybe starting at 5 or 6 o'clock. Start getting your room prepared. Make sure that it's cooler. And then also no screens, decreasing all the blue light and things like that. Calming the emotions maybe in the household as you prepare to get into bed so that you can have the most successful sleep that you can. And then overall, these books will guide you through the journey of perimenopause, menopause, and postmenopause. They provide key information, dispelling myths, and give you tools in your toolbox to select a menopause savvy provider who will become your who will help you become your best self during this stage of life through nutrition, exercise, supplementation, hormone therapy, and or medication. Best wishes on this new adventure. And so over here, I brought some other things that can help you on this journey. Some of them are medications, some of them are supplements, increasing your fiber, increasing your protein, helping your gut health with probiotics is super helpful. Lifting weights so that you can increase that muscle mass and you can increase your bone health to help you survive the next however many years you're gonna journey on through. But yeah, anybody have any questions?
You've got.
Yeah,
Awesome.